what we're doing in hyperbaric is we're taking you and putting you inside a chamber where we're increasing the pressure around you. And you are breathing oxygen through a mask. In some chambers, you're actually breathing oxygen in the chamber, but in our chambers downstairs, you're breathing oxygen through a mask. And that pressure actually dissolves oxygen into your plasma. So let's go back and figure out why that's so important.
Hey everyone. Today I spoke with Dr. Eleanor Womack, who is a Harvard-trained physician who found her way from a more conventional practice model to a very integrative model in which she uses a lot of hyperbaric oxygen therapy. In fact, she owns a clinic that administers this therapy, which is one of the therapies I am the most excited about because it can preserve and optimize the function of your brain, your mitochondria, it can fight infections, and it can reduce inflammation. It really is a fantastically interesting and effective therapy, especially if you're someone who feels as though you've done many of the things that should improve your health and you're still floundering. So we had a deep dive into hyperbaric, how to use it for things like mold, Lyme, mitochondrial dysfunction, brain fog, fatigue, and the like. So I really hope you will enjoy this conversation with Eleanor Womack. Eleanor, welcome to the show. I've been really anticipating this conversation.
It's really wonderful to be here. Thank you for inviting me.
Yeah, we met at your clinic because I've been doing hyperbaric and I've been doing experimentation with it. I have a chamber at home that's 1.5 atmosphere. And at your clinic, you go up to 2.4. And so I've been sort of feeling out the difference. And we ended up chatting. I didn't know you were the doctor of the clinic, but we were chatting. And very quickly I said, this is quite a smart person. And so I figured out pretty quickly you were the doctor behind the operation. And I think hyperbaric is an amazing tool. It's hard not to kind of get a little bit fanatical about it when you start looking at the research and the mechanisms behind it and all the things it can potentially help with. Like one example for our audience that I think they'll find pretty relevant is inflammatory bowel disease. Some studies, meta-analyses, have shown 80% response rates. And one study found a doubling comparing to just biologic immunosuppressive drugs alone. If they, in a separate group, did the biologic drugs plus hyperbaric, they doubled the efficacy of the drugs. So it's a really cool tool, and that's why I'm so glad you're here to sort of share with us what you see day in and day out. I'm sure you're seeing people with all sorts of different stuff from post-burn recovery, traumatic brain injury, maybe Crohn's. So would love to maybe start with just how you found your way from a conventional background over into hyperbaric.
Okay. Well, my background begins at Harvard Medical School, actually Harvard College and then Harvard Medical School. And I didn't like medical school at all because I had been grounded in science as a child. My father was the publisher and editor of Scientific American. So I met scientists throughout my childhood. My father's best friend was Linus Pauling, who actually sat down with me on multiple occasions and told me to think in the language of the electron cloud around every atom. And the only way you could really do biochemistry was to think that way. So I got science at a very pure level at a very young age and had very high standards. And when I got to medical school, there wasn't any science that was real that was being taught. And I was very frustrated, extremely frustrated. And so I became an Orthodox Jew during medical school and got married and didn't attend many of my classes my first and second year. But anyway, so I digress. When I got to the wards, I adored patient care and I loved it and I was good at it. And I loved internal medicine, and that's what I chose to do instead of surgery. I went through that to oncology. And I had another experience very similar to medical school in my first 2 years of oncology fellowship, which was we were not telling the truth to the patients. We were seeing ourselves that there was a 2 to 3% chance of this helping someone, but we were calling it by a whole different set of percentages using statistics to lie to patients.
Right.
And I couldn't do it. They were upset with me. They knew I was struggling. They made me take statistics again, and I didn't do well again. I wanted to tell the truth. And they finally said, well, you know what? We're going to have you not continue your fellowship, but you'll be the No Hope doctor of City of Hope. So I was at City of Hope in Duarte, California, and I really enjoyed practicing medicine in an environment where I wasn't trying to get somebody to do something for some other reason other than their wellness. And those patients lived. Those patients in the no hope category did better than the ones we were putting on chemo. And it created so much turmoil in me that right around that same time, I spontaneously conceived triplets and gave birth to 3 little boys in 1990.
That's a big undertaking. 3 boys.
3 little boys. And I went on to have 9 children altogether, but I retired from medicine. So I don't think I could have retired from medicine if I had just one, or if I'd had twins, I would have gone back. But with triplets, I didn't go back. And so I retired, and I didn't practice medicine for 18 years. And I really believed that I would never go back. The more that I read, the more that I saw, the more I thought that it was really a hopeless place where science wasn't being practiced. And then in 2008, 2009, some of my kids got sick, and I took them to see an alternative practitioner, and I was blown away by the fact that we were actually looking at the cell, and we were addressing nutrition. We were addressing nutrition because nutrition is important at a cellular level to how the mitochondria function. And I was off and running. And so I started reading, and I started also, at the same time, I had to learn the old stuff over again, because in order to get a license, you can't be practicing alternative medicine. You have to be practicing standard of care. So I studied standard of care and alternative at the same time from 2008, 2009, 2010, and passed the boards in 2010 to practice medicine in Texas. And the rest is history. I've been just adoring what I do for the last 14 years. Nothing could make me happier.
Love it. Yeah. And I share your frustration. Even being on the alternative side of things, there were certainly moments in my training that I felt it was ascientific, and there was a lot of sort of dogma and parroting. And that's a big part of the answer to your question you asked before we started the recording is, how did I get into podcasting? One of the reasons why is I wanted a stage to be able to share with people just fact-checked information. And it's amazing to me how, if you just take some time, it's not hard, it doesn't take a ton of resources to just fact-check simple claims, how often the actual truth, using that term loosely because in science, truth is sort of this hypothesis that's always evolving, but how the truth is oftentimes different than sort of the standard party recommendations. So totally with you on that. I want to dive deep, definitely into mitochondria, because this is something I'm getting progressively more interested in, especially with people who have fatigue and memory issues, thinking about what's put in the mitochondria kind of in this cell danger response and thwarting their ability to make energy. But in case people are new to hyperbaric oxygen therapy, let's maybe start with defining, how it works, maybe a quick lay-friendly recap on Henry's Law and Boyle's Law and some of what it does.
And actually, I want to start from the place of a publication of a paper that's coming out later this month by Dr. Saunders, who's been doing, this is his first paper, but he's been doing research in hyperbaric for a while.
Sure.
And he actually showed that 1.3, 1.5 has benefit with regard to cytokines, as well as being up in the higher pressures. So I am not speaking against one or the other. I'm actually an advocate of both lower pressure hyperbaric and high pressure hyperbaric.
Sure.
Not high, but mid-pressure.
And just really quick for the audience, most of the chambers that you'll see at wellness clinics or at home, they're soft walled, and they go up to about 1.3 atmospheres or 1.5. And then when you go to a clinic like yours, oftentimes they go up to about 2.4, 2.5 atmospheres, maybe sometimes 3. And there's a little bit of debate regarding, what are the better levels of pressure.
So the C crest doesn't go any higher than 2.5 that I know of. So really, in order to get up to 3, you have to go to the hospital. So hyperbaric in the hospital, where they've got chambers that go all the way to 8 atmospheres. And that's also what they have in the dive centers by the coast, where people are doing a lot of diving. And above 3 atmospheres, we lose efficacy for the brain, because at that point we're actually causing vasoconstriction in the brain that's so intense that people can have seizures or they can pass out. So we're not benefiting brain tissue when we're super high. And those high pressures are really needed for diving, but they're not needed for regular medicine. So we're going to be talking today about low pressure, 1.3, 1.5, and what my steel chambers do from 1.3 to 2.5, 2.4.
And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health. So it is quite deeply appreciated. Yeah, and I think that's a really important clarification because people don't have to go, to your point, to a conventional medical center and do truly a really deep dive. Somewhere between 1.3 to 2.4, 2.5 seems to be sufficient. And there's debate here, right? Because, coming to your earlier point and kind of how we're criticizing dogma and science, there's definitely a majority of papers that seem to be published at the 2.0 to 2.5 range. But we always say on the show that lack of proof doesn't mean disproof. And you're starting to see more studies being published comparing different pressures and all that just for the practical translation for the audience, that there's flexibility. Don't let the perfect be the enemy of the good. If you think 2.5 is the perfect dose, but you can only access a 1.3, that might be sufficient.
Yes. I am in complete agreement there. Absolutely complete agreement. So what we're doing in Hyperbaric is we're taking you and putting you inside a chamber where we're increasing the pressure around you. And you are breathing oxygen through a mask. In some chambers, you're actually breathing oxygen in the chamber, but in our chambers downstairs, you're breathing oxygen through a mask. And that pressure actually dissolves oxygen into your plasma. So let's go back and figure out why that's so important. It's so important because the only way that I'm getting oxygen right now to my tissues is through hemoglobin molecules picking up oxygen and then dropping it off at the end of a capillary. When I have oxygen in my plasma, I'm getting oxygen much deeper into the tissues because it can travel farther than when it leaves a hemoglobin molecule. And I'm also increasing the oxygen carrying capacity of my blood because not only is oxygen completely saturated on my hemoglobin molecules, but now I also have it in the plasma. And so I can go up to 120, 125% saturation in the blood, and I'm getting a 2,000% increase in oxygen delivery to the tissues because of the extravasation of this oxygen-containing fluid that doesn't have blood in it into my tissues. And that is really dramatic. And that means that areas of my body that are called gray or white, the white matter of my brain, the gray matter of my tendons and my ligaments, or inside my joints where we don't typically get any oxygen, those areas are all going to be oxygenated in a chamber at 2.2, 2.4, even at 1.75, even at 1.5. So we're going to get deep oxygen into the deepest tissues there. The next part of that, we're just going to say that the other really interesting thing is that there has been science done looking at the messenger RNA production in the body and saying, before I go into the chamber, what genes are turned on, looking at messenger RNA, and then when I come out of the chamber, looking at messenger RNA, and there are 2,000 inflammatory genes that are turned off after 4 to 5 sessions, and 2,000 anti-inflammatory genes that are turned up. And so I'm really doing something that is the holy grail of what we're looking for in medicine, which is I'm decreasing inflammation.
Right. Hence that Crohn's paper, right, as one evidence point, because one of the things we always sort of try to inculcate on this show is let's look at mechanism, but let's juxtapose that with outcome data when we have it, because sometimes the mechanism doesn't lead to the change we're hoping it was going to lead to, but there's so many outcome studies, whether it be post-traumatic brain injury or in Crohn's, where we see decreases in inflammation, which is, again, one of the reasons why I'm so excited about this as a therapeutic. You not only improve circulation, and for some people, and I'll put myself in this category, you get out of a dive and you feel like your brain is just turned on. And, for me, with some of the things that I've been personally trying to work through, Babesia and Bartonella, they can really decrease circulation to multiple parts of the body, including the brain. And so I can say as a user, it's been nice to feel like I'm back at full cognitive faculty. And not only that, but the mitochondria get more plump. I don't want to steal too much of your thunder here, but yeah, it's exciting because there's so many positive things that happen.
So if we're talking about If we're talking about someone who's sick, in sick and chronically sick, and sick in a way that allopathic medicine, right, the regular medical field really doesn't jibe with them at all. Doesn't They keep telling them that they should go see a psychiatrist. There's nothing wrong with you. Your blood is normal. You're fine. Um, that person is typically the person where there has been mitochondrial shutdown, and that will often happen because there's been a direct toxin. So mold is actually the enemy of bacteria, and our mitochondria are related to bacteria. And so when we encounter mold, there's a direct, specific detoxifying agent going against our mitochondria. And they go through something called the cell danger response. And this is the work of Navio. And he saw that in starvation conditions, in conditions where there was low nutrient content, in conditions where there was an actual toxicant, that cells changed their morphology for a few seconds. They came together. The nucleus creates a syncytial system with the membranes of the mitochondria, so that all of them are together, and they change their decisions about how they're going to run the cell going forward. And basically, they're saying it's too dangerous to be alive, and so we're going to essentially hibernate. So you wake up one morning after taking a shower at that black mold, and your body has already shut down. Your body has decided we're not going with you today. And so you get up to go to work and there's nobody there. You're dragging yourself because you literally don't have the mitochondrial fortitude to make things function. And so what's so incredible about hyperbaric by itself, so I'm an adherent to a very complex way to untangle mold from people's bodies. But I always tell people, well, this is complicated and you get to see me all the time, but you could just go downstairs to hyperbaric, and after about 40 sessions, your own body will say, hey, we're done. We can turn back on again. So I think that there's a signal that happens. We can actually reverse the Navio cell danger response and have a cell, it's all clear, safety response take place. Again, the nucleus comes together with the mitochondrial membranes, and they change their minds that they can turn back on again. And that is something that can be induced in hyperbaric under certain situations.
Love it. And I definitely want to double click on mold. This is something that we've had a number of guests on the podcast, and there's a lot there to unpack. There's a lot of different opinions. So I'd love to kind of pick your brain. But I do want to linger just a little while longer on gut and brain. Obviously, we've talked about some of the gut benefits, some of the brain benefits, but I know for our audience, these are two big levers that they're trying to improve. Obviously, mold can be a big part of gut and brain problems. But before we kind of do the deep dive on mold, what else would you want to mention regarding the gut and brain impacts or benefits that we can capture from hyperbaric?
Well, we replace the lining of our gut every 5 days, which is something I'm really aware of because of all those years of treating people with chemotherapy. People can't repair if their mitochondria aren't functioning, and if they've already turned off, and if they're eating foods that are toxic to them, and if they don't have the nutrients to cause that repair, they can get into a situation where their gut is always leaky. And the always leaky gut is an always leaky brain. And in a situation where I have a chronic infection like Lyme, or I have a chronic infection even with staph, I can get these infections across the blood-brain barrier. And now I'm dealing with a brain which is turned off because of the nutrient deficiencies, but it's also turned off because there's toxin in the brain. So I would say you need to heal them both at the same time. And I would do a lot. You can't ignore any of the legs of the stool. I mean, it's nutrient replacement and understanding nutrient replacement, and then not eating things that are toxic, eating organic and eating gluten-free and eating dairy-free if necessary. These things are super important, and they have to be adhered to, because every time there's a break, there's another 30 to 60 to 90-day change in the way the immune system is going to relate. Remember that the gut is where our immune system is being taught, and if I have bacteria coming across the gut blood barrier, and I'm seeing bacteria all the time, I'm always dealing with a 10-alarm fire, and I'm not doing the regular normal immune regulation system. I'm not the generals aren't reporting to the right person.
Right. And, the first person I heard talk about runaway inflammation in the brain was Datis Karazian, and he discussed a lot about how the microglia and the astrocytes just kind of go a little wild, and you have almost these feed-forward, self-perpetuating inflammatory cycles in the brain that can lead to chronic brain fog, just a really kind of short life of being able to think in a day. People might say, I've got like 2 hours in me, and then after that, I crash. One of the things that I found so interesting when reading up on some of the hyperbaric literature is you'll see a suppression of microglia and astrocytes, that falls under the umbrella of the anti-inflammatory, but it permeates. And we even have data showing specifically these brain immune cells go from this hyperactive state to more of a normative state.
Yes. And so we have, probably 25% of the people that are coming downstairs are dealing with a neurological diagnosis. Either they're trying to stave off a genetic propensity towards Alzheimer's, or they have early cognitive decline, either because of a previous head injury, or because of a previous infection, or because of a stroke, or because they actually have the genes for Alzheimer's. And in those situations, there is dramatic improvement. And it's dramatic improvement that's self-created. The body has, I know everyone knows this, but the body has the blueprint to heal itself when we give it what it really wants. I like to tell people that when you get into a hyperbaric chamber, it's like I was giving a city an unlimited budget to build a school, to replace the police department, to rebuild the roads. And so the brain without oxygen is waiting for their ship to come in. It's waiting for, well, we could do this if we had that, and we could do that if we had this. But once I give you unlimited oxygen, you can repair.
Mm-hmm. Yep. No, I think that's a fantastic analogy. I'm probably going to steal that from you about, the unlimited budget for repair and defense and building and what have you. So we're in Austin, and Austin is a very hot, humid climate, which I learned more so firsthand after moving from wonderful California, where, at least where I was, it was very arid and mold wasn't really so much of a thing. And then here, if you don't have a HVAC, as one example, that's well maintained, as I learned, there was, and the audience knows this, but just for you, there was visible mold all throughout my HVAC. And that accounted for why every time I turned the air conditioning on, I had brain fog. And so then I learned how important proper HVAC maintenance is. And that pulls you down this whole rabbit hole of mold. So let's go down into this rabbit hole. Probably a lot here to unpack, and I don't think we can do the topic full justice in one conversation, but what are some starting points that you find to be important regarding mold?
Just one more little fact about Austin. Austin is built on rock, and it has 2 inches of topsoil. And there has been the use of Roundup or glyphosate in farming and on golf courses for more than 20 years. And we now have so much in the water table that it's now raining glyphosate. So it's raining glyphosate on 2 inches of topsoil. And that glyphosate kills the bacteria in that soil who were at war or keeping in check mold. So now what we have is miles and miles of square miles of topsoil that's just fungus. And I have seen many, many black lawns. My lawn was often black after a good, warm, wet day. So we are dealing with something that is, I think it's why the allergies are so high in Austin, because everybody's got a little bit of actinomyces, a little bit of mycos, a little bit of mycotoxin, a little bit of endotoxin, just from walking around outside. And I've actually sent a few patients to live somewhere else because they couldn't live here. So that would be the next part of where I'm going to start. Is I have to apologize because I have been working for the last 12 years with Dr. Shoemaker and Dr. Heyman. So those are my teachers, and that's controversial because there are people who really do not like the Shoemaker protocol and don't want to go there with the Shoemaker protocol. And I apologize to all of you, and I say that you have to do what works for you. And I believe completely that there are other ways to go. The only reason I've picked this is because that's where my education was. And when I do it right, when we get it all right, it does work. So that would be how I would start out. And then I do break the rules with the protocol in that I will often say to people, okay, we've done everything we possibly can do. Let's do 80 hours of hyperbaric, and let's see if we can get around some of these other problems, because there are blocks in that protocol where you can't go forward because you can't get anything fixed.
And do you have just like an estimated response rate when people haven't responded to the modified Shoemaker protocol and then you go to hyperbaric? Is it 30%, half of people, more than half of people?
I think it's half of people. I think very often the big problem with the Shoemaker protocol is that, and I think probably with all mold protocols, is it requires you to be removed from your exposure. And I don't think people know how to get that done, and I don't think they know what it means. They think that if they move to another place, they frequently don't test in the new place. They just say, well, if I went from that place to this place, it must not be moldy, but the new place may be moldier than the old place. So I think that the first thing that I'm doing it's really pedantic, but we're testing the houses for actinomyces, mycotoxin, and endotoxin every time you move, and every time there's an intervention made. And I want the patient to test themselves. I want them to use their own thing and not have somebody they hire to come in and do it. And I use a company called Lyss Biotech that has a fung ID and a BAC ID and an endotoxin panel, and it's, to me, the most sensitive panel. And by using that panel, I've actually been able to figure out why some people weren't responding. They weren't responding because they weren't removed from exposure.
And so this panel is testing the environment, or it's testing the individual?
We're not testing the body. I'm actually testing the environment they're living in. And I'm not somebody, because I'm through Shoemaker, I don't follow body burden unless we're in a legal case and they need it for a legal reason.
Yeah, I ran the urinary mycotoxin test for a while, and the audience knows this, but we're even working now on a retrospective case series where we really gave it the old college try, and we tracked people's body burden via urinalysis at baseline, looked for correlation to their symptom severity, treated them with binders and other things for a number of months, and we just, and also the obvious of remediating the environment to the best extent that we could. And we just were not seeing a dent in their post-testing levels, nor any correlation between follow-up testing and the severity of their symptoms. And it might be that
if they're here in Austin, that may be because they're exposed every single day when they go outside and breathe.
Yeah.
And
yeah, sure.
I wouldn't do this test in Austin because everybody.
Yeah, and I had a friend who actually moved to I think it was Oregon, like an arid region out there, because he said he just felt so much better. And to your earlier point, I wanted to say that when you move to Austin, you hear so many people say, I didn't have allergies until I moved to Austin. And then after a year or two or something like that, they have allergies. So there is something to that. I do think it's a harder climate here to really thrive in. But again, to your point, the urine testing, haven't been a fan of that. We recently had on the podcast Andrew Campbell, who is a big advocate of blood antibody testing, and we're looking at that. His protocol of itraconazole and maybe amphotericin B if there's suspicion of nasal involvement or colonization seems attractive. But I have to be honest, with everyone in the mold camp, I find some things that I like and some things that seem a little bit hard to justify. And I guess, sure, nobody has everything figured out. But right now we're sort of utilizing the Campbell protocol, and we've been working on giving people guidelines for home assessment. Because I think one of the points you were making was there's a massive variability in local consultants to do a home eval. So what we're working on is just finding a few of the people who come the most highly recommended, taking their ideas into like an article that we can equip someone with so that they can quarterback a lot of this. Because it's so hard as a clinician to try to go through that patient to their home. And I think we just need to give people some good usage guidelines to quarterback this on their own.
Well, I've actually been really blessed. There's a man named Larry Schwartz who runs a company out of Pittsburgh called Safe Start. And I have been working with him for the last 8 years, and I meet with him and my patients. We go over their Lyss Biotech results. We go over the the Gini test. So I look at a messenger RNA blood test to see if the DNA is turned off and how the DNA is turned off, and whether or not they're most sensitive to actinomyces or most sensitive to mycotoxin or most sensitive to endotoxin. And then every visit with this, Larry Schwartz is about, I think he's Yoda's cousin. He's about this big, and he's about 110 years old.
Oh, Yoda's cousin. Okay.
He is the sharpest, the absolute sharpest man in the tack. I mean, he can go on for 2 hours with a patient. Maybe it's because the patients have brain fog, but I don't have brain fog, and I can't keep up with him. He's really, truly incredible.
He is both a Yoda in stature and in cognition, I guess.
Yes. And in every city in the country, he knows who's the best person to work with and who's the most honest person to work with.
Great.
In terms of remediation.
We're going to look him up then. Okay.
And that's made the difference. And it wasn't until I got Larry Schwartz involved that I actually got people better. So my statement to people with mold is that it's not that the clearing of the mold, the binders not working. It isn't that the help that we're giving you nutritionally to repair your mitochondria is not working. It's that you're still exposed. And you don't know that you're still exposed, but you're still exposed. There could be mold in your car air conditioner. So you could be exposed on the way to work. There could be mold in your workspace. So there are also leaks in indoor buildings where we work. It's not just in our homes. So that's been the issue. I think the reason that I'm now feeling successful and good about my helping people with mold, which I didn't feel the first 5 to 6 years, it was awful. But in these last 8 years, I really feel good because we're getting people away from exposure. So I cannot emphasize enough that if you're not removed from exposure, everything you do is useless and is a waste of money and time.
Yeah. How do you feel about someone having a somewhat clear environmental reactivity as a proxy? Meaning, in my observation, there's kind of two camps of people where some people will say, every time I'm in my kitchen, in fact, this is Dr. Scott from our clinic, he said, I feel like there's mold in my kitchen somewhere because I feel good until I go into my kitchen and then I don't feel well. And he actually just found on the bottom of his, fruit and vegetable pull-out drawers, all littered with mold. And apparently there's some sort of small leak in his fridge. There's an active colony there, and the spores are just building up. So he opens up the refrigerator door. He goes from feeling great, working all morning, opens up the door, and he's foggy for a couple hours. So that's one camp in my observation where people have this sense like, I'm feeling good. And then I go to work and I don't feel well. Or like me, the AC turns on and I don't feel well. That's an easier one to say, that almost for certain there seems to be mold. The other camp that is more challenging is where there's no clear environmental correlation. And even if they've traveled and they've gone on vacation somewhere, they don't feel any better. Now, the vacation isn't a perfect test because sometimes they might go, like you were saying before, from one moldy place to another. But at least it can provide a clue if there's improvements when they leave. So the question I'm trying to ask you with all this preamble is, how reliable do you find some suspected environmental reactivity to be predictive of there being mold?
In the patient you just described, I would begin to wonder if there wasn't Lyme as well, or there wasn't some other infection that was constant. So that's why they're not getting better. And they could be sick all the time and then get much worse exposed to mold. So I've had Lyme patients that also had mold. So again, so you got to treat them both. And I'm looking for ways to treat Lyme without antibiotics. I'm looking for ways to treat mold without antifungals. I mean, I'm always looking to do no harm because I find that the things that we prescribe can be so toxic to people.
Yeah, and that's one of the things that we kind of bonded over during our conversation at the clinic was other options than antibiotics. And I was sharing with you how jazzed I was learning about hyperbaric and obviously herbals and wondering if for some of the people that don't respond fully to Lyme herbals alone, if the union of hyperbaric along with that will be enough to get them over the hump and not require much stronger antibiotic protocols.
So the one, I know that you just said that you have a history of Babesia yourself.
I do.
And what's interesting to me is that you're doing so well in hyperbaric, because to me that would kind of tell me that you don't have Babesia anymore. if you still had Babesia, it would be flaring when you were in the chamber. Babesia lives inside the red blood cell, and it does that because it loves oxygen. And so when it gets oxygen, you actually can have a worsening of your Lyme. So if I'm going to treat a patient with Lyme in hyperbaric, I want to make sure they don't have Babesia, or that their Babesia is treated. And the Babesia is, I think, the easiest to treat with the herbals. It does respond very well to the herbals.
Well, certainly there's a whole host of antimalarial herbals that seem to work well. And this is something that there's not really, as I've seen, any research on Babesia. The one paper that kind of gives us a hint is that Fife paper from the 80s, where he looked at, I always remember it was like 1980s, and it was about 80 patients and about an 80% response rate. Not exactly, but it's roughly. Now, this was in Lyme patients, but we know that co-infection is pretty common. And there was one, I believe it was a Nigenic study that found, I think it was about 40% of people had Babesia, about 37, I think, had Lyme, and about 20 had Bartonella. So what I think may have happened with the Fife cohort was you had all these patients way back when in the 80s that could test for Lyme, but Babesia testing wasn't that advanced back then. They probably weren't even tested for Babesia to begin with. But a subset of those people must have had Babesia, and nevertheless, they still responded well. So I get what you're saying about it being a oxygen-loving protozoa, but I do wonder if maybe while on the one hand that oxygen would feed the microbe, maybe by strengthening the mitochondria, shutting down inflammation, treating co-infections, we kind of hit this net positive effect for the individual. I mean, it's speculative, but I don't think anybody really knows.
I love that. And I would say we treat probably 15 patients with Lyme every year downstairs in Hyperbaric. So these are not patients of mine necessarily. These are people who are coming from the outside. They're being referred in by other physicians. My clinics are open to other physicians and for patients to self-refer. And I have lots of people in my clinic who have had chronic fatigue long enough to have spent all their money. And so they're coming to Hyperbaric saying, I don't have any money to see a physician, but I know that my own body knows how to heal itself, so I'm going to get in this Hyperbaric chamber and see what it can do. And I would say we do really well with Lyme. But out of those 15 people, every year there's one or two who by the second or the third session is sicker. And I will often say to them, or if someone calls me to ask me, and my nurses also will tell them, hey, if you're getting sicker, let's give you your money back, and let's go, why don't you go experiment with getting treated for Babesia before you come back?
So, I mean, I'm so glad you asked this question, because this phenomenon, especially of a neurological Herxheimer's, can be pretty nasty. And I can say I've gone through this. I recently did a round of SOT. And for the audience, SOT essentially targets the genes of the microbes and prevents them from replicating. And I was laid up on the couch. I was essentially couch bound for about a week. Now, okay, it's part of the process, and sure, I can look into Joseph Campbell's work and study up on the hero's journey and just like get myself some motivation to get through it. But what I wonder is happening is how much of this is a Herx, right? And so it's delicate because you don't want to tell someone to keep going if there's potential signs of them flaring. But on the other side, I can say of that Herx, I felt like many of these faculties were starting to come back online, especially cognitively. In your setting, it's probably a little bit harder because you're not acting, it sounds like in a lot of cases, the primary physician where you can steer everything. But what are your thoughts there about this potentially just being a good thing in a way, in that it's a Herxheimer's reaction?
A Herxheimer reaction is a wonderful thing. In Babesia, it can be really severe. I mean, I've treated my own patients. I had a patient with Lyme who I treated with a 10-pass ozone who got extremely sick and stayed sick for about 6 weeks. So that's too much of a Herx. That's too high. That's too much. So I think we have to be very careful. And so I always want to know if Babesia is present, because I don't directly want to poke it in the eye. I'd like to, step on its foot, but I don't want to poke it in the eye.
And I'm also with you. I do think that as a general rule, and this is how we've been advising people at the clinic, let's try to soften up the microbial load with antimicrobials and all the other things first, and then send in the reinforcements of the hyperbaric, and not do it the other way around. Because I do wonder if these microbes, let's say they're in biofilm, and all of a sudden you're hyperoxygenating. Now the biofilms are turning on, and the immune system is trying to fight this battle, but it's not really equipped enough alone to succeed. So you kind of just end up throwing your immune system into a battle that it can't win. So that's why I like bringing down the load first with herbals and then sending in HBOT as like a reinforcement.
I like that. I have another tool, again, because I'm so committed to not treating people pharmaceutically. I have a wonderful machine called a Weber IV. It's an IV that takes a filament about that long and puts it into your arm. So you're not getting fluids through this IV. You have a filament in the blood vessel. And the filament is then attached on the other side to a laser. And there are 5 lasers. I have a UV light laser. I have a red. I have blue. I have green. And finally, a yellow light. And the whole blood volume is exposed to that light. We change the light every 20 minutes. So during that time, the whole blood volume goes by that catheter at least 7 times. And so the whole blood volume has seen this light. And in that process, what I'm hoping, particularly with Babesia, and I think this is where I've been really successful, and the things that I've treated successfully with it have been Babesia and shingles and EBV virus in young people who are showing up for their first case of mono, but then their parents who are getting their own case of mono that's recurring because the kid got mono. And I can make mono go away with just 2 infusions of this. And what we're doing is with that UV light, I'm actually breaking the viral capsid, or I'm killing some of the Babesia, and I'm identifying it to the immune system. Because if we're thinking about these hidden organisms that don't really want to be found, the immune system doesn't know to target them because it doesn't see pieces of them. But now I'm presenting in that 20 minutes pieces of them. With the red light right afterwards, I'm actually upregulating all of the processes that have to do with immune surveillance. And then with the blue and the green lights, I'm upregulating the ability to make superoxide dismutase and make peroxide, and I'm improving the function of the white blood cells. And then following with the yellow, I'm helping to clear the body and to calm the person. I've also used the yellow light for depression, and I've used the yellow light for people with severe anxiety. So that is another way to think about things. That and to combine light with hyperbaric is also very interesting, because light is all about mitochondrial function, and so is hyperbaric. And when you combine the two, we see dramatic results. I have a light bed downstairs. I don't know if you've gotten in the light bed in addition to your
Well, I was actually
sessions.
teasing one of the attendees and saying, "Oh, I didn't know you guys did tanning here." And she's like, "No, it's not tanning; it's a red light bed." So I've seen the bed. I haven't used the bed, but I might want to try this laser because it sounds really quite interesting. And I'm with you. I mean, UV obviously is a really powerful antiseptic. And it's another way of applying that.
And I was doing from 2011 on, I was doing UV autotransfusion in my office. So we would take blood out, put ozone
It's
with
the
it, and then
EBO3.
this is no, not EBO3, and this is not EBO3, and it's also not 10 pass. This is 1 pass, so it's just 250 mLs of blood that's mixed with ozone and then reinfused back through a UV light. And so we're killing organisms. And that was what I was using to treat Lyme, but it wasn't very effective because I wasn't getting enough of the blood. I was only getting 1/16 of the blood volume. I wasn't getting enough blood to really make a difference.
With the Weber laser, how long does a treatment session last? I'm assuming it's like an hour,
It's
maybe?
an hour and 20 minutes.
Yeah.
So
Okay.
it's 20 minutes on each light, and then and we do 40 with the yellow.
Gotcha. Cool. And how widely available is that? Because I'm sure people are going to ask. And is there maybe some sort of website they can go where they can find
You
people in
can
their
go
area?
there is if you look up Weber IV, there is, they do tell you about who's got one that I know of in Austin right now. I think I'm the only person that has one, but that seems really ridiculous because it's such a great therapy. So somebody must have one, but I, I don't know who does.
And what about outside of Austin? Because we have people listening all over the world, all over the country.
There are at least 5 practitioners in Florida because I've met them at meetings. In Los Angeles, I think there are 4 or 5 that I've met at meetings. And then I know there's somebody in Vermont. And there are 2 people in Portland. So
Gotcha. Nice.
it
Okay.
is,
So
it
there's
is.
some hubs. Yeah, yeah. And just anticipating someone saying, this sounds like it might be applicable for me. I've done a lot of the things. I'm not feeling much better. Is there a minimal number of treatments someone should try to make themselves available for?
So if I am treating Lyme and it's a new patient who hasn't had other treatment, or someone who's very symptomatic, I'm going to tell them that this is going to be 9 sessions. I want you to give it a try. You might not notice much the first week. Try to do 3 a week for 3 weeks. That would be where I would start. Patients that have gotten super better, if some of them have done 12, some of them have done only 6. For someone with shingles, it's just 2 or 3. With someone with EBV virus, it's just two treatments.
Gotcha. Okay. No, it's really helpful because I think giving people what the minimal effective dose is, just so because I'd like to think that whatever clinic they go to would advise them on that. But if it's someone newer to that tool, they may still be sort of feeling this out. So, okay, you're trying to do about 3 weeks, 9 sessions over that 3-week period, roughly speaking.
Another thing that is out there is Rife, frequency treatment. And I'm not an expert. But I was just gifted a Rife machine that was made in the Appalachian Mountains. It has only one frequency. It only treats Lyme. And I also wanted to offer that to you as something if you wanted to experiment with it.
Yeah,
Because
I'm open to anything.
not offering it to patients yet. I want to get used to treating people with it. But I'm starting at just 5 seconds. So the exposure to the Rife would just be 5 seconds.
Yeah, I'll be a guinea pig.
Yeah, it would go up to 10 seconds and then 20 seconds. I mean, so it'll be very, very, very short exposure to prevent you from having too severe a herx.
Gotcha. For herxing, is there anything in particular that you found to be helpful?
That yellow light, I think, at the end is really wonderful. And if someone is having a really severe herx, we'll put them in just for an hour with the yellow light. Other things, if they don't have IV access, charcoal. And if they know they're going to herx, I'll have them do charcoal. I do have that the EBO2, which is a machine that does it ozonates the blood, it radiates the blood with light, and it returns the blood to you after it's gone through a dialysis filter. So we're getting rid of proteins, including spike protein, and so we can use that for long COVID. It's extremely expensive because the amount of equipment is expensive to start out with. I thought it was going to be more successful. It was given to me by one of my patients, and I had concerns that it wouldn't be successful. And we were only treating about 3 people a month, and except when someone's got long COVID and really wants to commit to it. So I would say 3 sessions on that with long COVID is really a wonderful way to go.
Something I came across recently, credit to Elliot, Overton, and Nick Hedberg for putting this on my radar, but nicotine along with protein-degrading enzymes for long COVID. I've heard really good things about this. Haven't recommended it myself. Have you any experience with this?
I've treated about 20 people with nicotine, and I'm a big believer in nicotine. And then they are always on lumbar kinase and nattokinase along with it. So.
And are you using a patch? Is that your preferred method, or do you use gum for the nicotine?
Patch.
Camels?
So a patch cut in half at 3.5 milligrams, and then a week later go up to 7 milligrams.
Gotcha. Okay, cool.
Sometimes people feel better than hours with nicotine.
Yeah, I use nicotine gum as something just before a podcast, I'll chew on a 2 milligram piece. And I notice a nice little bit of, cognitive clarity here. So I'm a big fan. Okay, so then let's come back to Hyperbaric, because I'm sure people are curious about this. We found a company that I think is just wonderful. They will ship people soft chambers, 1.3, I think they go as high as 2.0 actually. And it's a 2-month rental commitment. And you can apply that fee toward ownership. So if it's someone not in an area where it's accessible, and we do a lot of telehealth, so we have people all over the place, Just a wonderful, wonderful company where for $900 to $1,200 a month, yeah, I mean, it's an absolute steal regarding the price. Uh, so giving people parameters, I think, is really helpful for sort of, loading. It seems that people want to get to at least 20 dives, probably more like 40 dives over a truncated period of time. But how are you
I
loading
think
this?
if you got this in your house, I would actually, if you're spending the money and you want to get better, I would treat twice a day. I would treat
Mm.
twice a day for every day you were there, maybe taking one day off a week, so that you could get 40 hours in. You really do want 40 to 80 hours. I mean,
Oh, I'm
if
sorry.
you
Do
have,
you take a break in between that, or because I've seen different protocols where maybe it's 40, a 2 week maintenance period, and then another 40. How do you sort of load that?
so I do believe in breaks at the 40 and sometimes at the 20. So again, it has to do with how the patient's feeling. If you're feeling great, but you're having headaches, I want you to take a 2 to 7 day break. If you're feeling fatigued, I want you to stop and take a week to 2 weeks off. Um,
And the way I
if
kind of
you,
interpret that is if there's signs of oxidative stress, like your neck's really kind of sore, you have a headache, but everything else is good, then you might be able to buffer that. But if it's systemic fatigue, it's probably just far too much oxidative stress, and now we want to take a break. Yeah.
let's talk for just a second about oxidative stress. And the big question so many people have about hyperbaric is, but why I've been told that I'm really sensitive to reactive oxygen species. Aren't I creating more of those in hyperbaric? And that has a really beautiful and gentle and loving answer. If I give you ozone, if I do a 10 pass ozone on you, I'm actually giving you reactive oxygen species. I'm putting them directly into your blood. And that is a reactive oxygen species exposure that could have its own issues because it's reactive oxygen. When I'm putting O2 into you, so in the 10 pass ozone, I'm putting O3 into you. In the chamber, I'm giving you O2. And the only place the reactive oxygen species are created is in the delta comes from the increase and improvement of mitochondrial function. So the mitochondria are functioning at this low level, but now I give them enough oxygen so that they heal and they improve. And they're making their own reactive oxygen species that is normal in the function of a healthy mitochondria. The other thing that happens is that the enzymes that deal with reactive oxygen species, the SOD genes and the glutathione genes in the mitochondria actually are upregulated by the stress, and they come with the stress. So as the stress grows, it grows. So if we're talking about reactive oxygen species and the danger of them and someone going into hyperbaric, I really think it's a nothing burger. Of course, there'll be exceptions to that, but in general, it wouldn't be my first concern. And I do Intellex DNA as part of my assessment of patients, and I have patients where there is this warning that comes with their chart, which says these people are particularly sensitive to reactive oxygen species, and I won't do a 10 pass ozone on them, but I will put them in a chamber with feeling very comfortable that they're going to do great.
I love that you made the clarification. And the analogy we've been using for patients who sometimes had that same concern is it's loosely akin to exercise. It's a healthy hormetic stressor that your body then adapts to and becomes stronger because of it, as long as the load is correct. And also, like exercise, there is such a thing as doing too much exercise. And now you start having shoulder pain and neck pain, and we want to pull back a little bit. But yeah, I'm totally with you. It's amazing how SOD, glutathione, all these antioxidants get upregulated that then protects the mitochondria. And this is why there's been a couple really fascinating studies that stain the mitochondria, and you get more of them, and they also get larger from doing hyperbaric. Okay, so we want to hit ideally 40 and then maybe do 2 weeks off and then do another 40. I guess let me sharpen that question. There's sort of the initial loading, and then there's a pivot to maintenance. How do you sort of navigate when you're done with the active treatment phase where they're doing 1 or 2 dives a day, and then they go into more of a maintenance phase?
Well, I'm in my mind, I'm thinking about this person who's paying $1,200 a month to have a chamber in their home for those 2 months. And so it breaks my heart to say to them, hey, you need to take 2 weeks off. But if you needed to take 2 weeks off, maybe you get a third month. So
Yeah, I
maybe
mean,
you
the
pay for
nice
it.
thing is that at $1,200 a month, not to say that that's nothing, but it's a really good value. If you're going to go, to a clinic, it's usually $100 to a couple $100 per one dive.
Yes, yes. So I would say, assess yourself at 20 hours. At 20 hours, you should have 800% increase in your circulating stem cells. You should have a real dramatic change in the way that things are about to happen. You might not have felt better yet. You might still be struggling with how you feel, but you're primed at 20 hours to really make a difference. If at 20 hours you're having headaches, take 4 to 5 days off. But please get right back in, because we want to keep those activated stem cells. We want to give them now the soil in which to grow. We want to allow you to make new capillary beds and bring new blood flow to areas that haven't had it. And then at 40, I would love you to take 2 weeks off. And the really interesting thing in the literature is that when they look at people, they do assessment of cytokines, or they do assessment of what mRNA is upregulated and what mRNA is now downregulated before, during, and then after. There are still changes that are happening a month after you've gotten out of the chamber. You're still improving a month after you got out. So it's totally okay to take 2 weeks off. There is still healing going on in your body if you need to take time off. And I would insist on it at the end of 40 hours, because you will benefit. And then when you get to when you do your next 40 hours, you'll be even better.
And with
So
that 2 weeks, are you doing a maintenance dive per week during that 2 weeks, or just 2 weeks off completely?
I'm having 2 weeks off completely. If
Okay.
you wanted to do a maintenance dive because you really wanted it, you certainly could. And I don't think it would hurt the healing process either. I have treated a couple of people, most famously a young man who had a severe head injury and was clinically dead. They said he was brain dead in the hospital for 6 months before they took him off a vent. He didn't die when they took him off the vent, and his wife brought him to us, and he was completely unresponsive. And after 240 hours, he was caring for his children, which was a good thing because his wife died. But he was up and around and functioning well. So in his case, we treated 40 hours and gave him 2-week breaks in between all of those 40-hour sessions. And he told me personally that he felt great at the end of the 40 sessions, but then he was feeling really good right before he got back in. So it wasn't as though he got out and then he started to feel less good. He continued to feel good, and then when he got back in, he was feeling great.
Right. Okay.
He'd actually been blind because the injury to his head was crushed the occipital lobe, and he could not see. And after those 240, he had his vision back, except in one area in the
Wow.
lower left hand.
It's remarkable.
So hyperbaric can do incredible things when people they really say to themselves, I'm going to do hours and hours and hours. I think that hyperbaric doesn't work when people say, well, I did 5 sessions and I didn't feel any difference.
Right.
You need at least 20 hours to get the stem cells up and moving, and then you need another 20 hours to put them to work.
I'm so glad you made that point. And it also follows with another question, which is longer term maintenance. I know this is going to be a little bit use case dependent. This is something Saunders, I think, does a good job of sort of delineating different use cases, where if it's an acute head injury or a burn, then it's more of an acute intervention. If it's something like chronic fatigue syndrome, Lyme, mold, maybe ongoing. And then that's how I think about it, is that maybe you want to do a few rounds of a month of treatment per year. Once you've gotten to that clinical endpoint, maintenance would be,
I envision a world where we all have one of these in our homes. I'm that fanatical. I really am that fanatical. And so that I myself, I try to do 60 sessions that are consecutive every year. And I did it this summer. And during that time, I had perfect eyesight. I didn't need glasses at all. And I barely need glasses now, but my distance vision improved dramatically, and I got rid of my readers that I'd had, and I'm 65, so I shouldn't be reading with readers when I'm not. And when I stopped, I kept going for another 20, but I did those in blocks of 3. And right now I'm not in the chamber and I'm missing it. So from my perspective, I would love to be getting in once or twice a week, even now on a daily basis. And I probably will after the new year. It's just that right now things are so busy. So what I would love for people to be able to do is those 40 sessions that are as consecutive as they can be. So you're doing 5 hours a week for 8 weeks, or you're doing 2 sessions a day for 4 weeks. And then after that, 2 to 3 sessions a week if we're trying to deal with something like chronic fatigue. If you have another downturn, or you go visit somebody and you get mold again, then you've got to go through the whole treatment. You've got to make sure that your environment's clear, go through your binders again, and then get back into hyperbaric and do another 40.
And for someone who, let's say, in a decent number of the Lyme cases, it seems that the treatment's going to be maybe several months due to the slow-growing nature of these bacteria. Would you, in a use case like that, after you get to the first 40 or 80, would you do another 40 or 80 after maintenance for a month or two? Or how do you cycle these repeat treatments, if at all?
Well, we're talking about cost and we're talking about time. I mean, at this point, it's what can we wish for? What would I wish
maybe
for?
starting with the ideal. And sorry,
Yeah.
the use case I'm thinking about is either selfishly someone who has a unit like myself, or with this wonderful company where they allow you to do that rent to own, so people can really take this. They don't have to commit to the full purchase, and they can sort of feel their way into it. So let's assume that cost isn't so much of an issue, and it's more so what would the ideal be?
Ideally, I think we would do 40 hours with 2 weeks off, 40 hours with 2 weeks off, 40 hours with 2 weeks off until you felt normal, or even superhuman.
Okay.
I
I also will say that I had a point where I did feel superhuman at the end of my first month of 2.4 atmosphere dives, and I was also doubling up and doing a 1.5 session at home. The thing that was so interesting to me was I had this breath ketone meter, and I was able to get into deep ketosis, really deep ketosis, and I felt amazing. Now, about a month after ending the hyperbaric, I was eating the same diet and I still couldn't get into ketosis. I even went full-blown carnivore for 4 days, still couldn't get into deep ketosis. And this is one of the things that really opened my eyes to the mitochondria and how important they are for fatty acid oxidation.
Yes, it really is. It's wonderful. I've done more than 500 hours myself in the last 9 years. The first year, I didn't have. I think we had 8 to 9 patients a day, and we had. Anyway, I got in the chamber every evening, at least 4 days a week, if not 5, for that entire year. And maybe took weeks off when I traveled. But I thought of it as where I did my work. So I would bring my laptop and my charts and do my charts in hyperbaric before I went home. It
And
changed
what did
my
you notice? Yeah, please.
well, it changed my life. I had never had intellectual confidence. I'd always felt small, and I felt intelligent, which is ridiculous because anyway. Never mind. But I felt intelligent, which the felt sense is really wonderful. And I also had energy, and I also wasn't limited by all the aches and pains I'd always had. So I had 9 kids in 10 years, and did a lot of lifting and a lot of laundry, and really wiped out my back. And I always had a baby on my hip, and so I had a twisted pelvis, and so lots and lots of body pain. And the body pain was cut in half, and I felt vital, and I felt like I could really start exercising. And then I would also say there's a subtle effect in me on mood, because of course, if you have chronic pain and if you're fatigued, you're going to be depressed. So depression lifted as well. So there was a brightening of my mind and improvement in my physical environment.
Yeah. I mean, I do think it's a really phenomenal therapy. And I could see maybe this is a utopian vision, but a scenario where a lot of people, almost like I wish the Nordic countries' adoption of sauna would be more mirrored in the US, because it's another just amazing if you look at cardiovascular and neurocognitive outcomes with sauna, and all you do is just sit there, right? It's not, I get maybe some people don't love to exercise. For either one of these, you just sit, right? So it's a much, I think, easier compliance ask. Yeah, I'm with you. I think, again, it's a really fascinatingly interesting therapy. Another question I wanted to ask about this is, what synergist, if any, do you recommend that people use? And maybe these aren't, maybe these are going to be like a 3% bump, and the real important thing is just doing the hyperbaric, and the synergists are, somewhat null. But anything that you feel is a really important adjunct?
Of course, the fad of methylene blue is huge, and there's a lot to be said for a smaller dose. I mean, I'm going to let you figure out the dose yourself, because I think people are doing too much, but that's my own opinion. So little bits of methylene blue would be wonderful as something that you did maybe an hour before your session, so that it was up and running. I think everybody ought to
And sorry, really quick, when you say little bits, is that 5 milligrams, 10 milligrams?
10 to 20.
Okay.
10 to 20 milligrams. So I'm not in the 40 to 500 milligram category. And there are people actually combining it and going up to 40 to even 50 milligrams.
Yeah. And some people using it for Bartonella in really high doses, but that's a different use case.
And that's because your kidneys are healthy and you're being followed by a physician. I would not do any of those things by yourself. So then that's where I would start with methylene blue. I also think that everyone should have nitric oxide maximized. So taking your favorite nitric oxide supplement before you get in the chamber would be a very good idea. And maybe even adding another before you go to bed that night. I think combining it with light therapy, even going in after the IV light, doing IV light and then getting into the chamber, or getting into the chamber and after the chamber getting into the light bed. And but I wouldn't do that if I wanted to get
You mean
sleep.
red light,
so
specifically?
I would do
red light?
Red light. And actually our chamber, our light bed has 6 different lights in it. It's a poly.
Oh, cool.
Yeah. So I think light is wonderful. I think exercise is wonderful. So I think if someone is exercising regularly, it's going to help their hyperbaric be more functional.
Well,
And
when
then,
I
of
was
course,
shopping for a home chamber, I didn't go with this company because they looked ridiculously expensive, but they were really marketing to professional soccer teams for recovery. And I think there was even one that had like a Manchester United logo on the chamber. And you do hear athletes remark about recovery. And if you think about if you're going to spur new blood vessel creation with hyperbaric in the brain, but also the muscles, then that's going to help in part with both endurance capacity and with recovery.
I also see synergy between anybody that's doing, if they're doing any kind of injections, if they're trying to create stem cells for platelet-rich plasma, or they're trying to create stem cells to be harvested with a bone marrow harvest. I think in both those situations, hyperbaric's great. And I think that depending on talking to your physician, because some people believe that they need to actually have some inflammation for the first 3 to 5 days. But after those first 3 to 5 days of your injections, I feel very strongly you can get right into hyperbaric, and it'll actually help whatever tissue healing you're doing. So I think you'll get a better result if you pre-treat, and I think you'll get more from whatever you put into your body post. And if you're doing just umbilical stem cells or someone else's stem cells, getting in the chamber is a great idea following.
Yeah. And that's actually regarding stem cells. That was one of the papers that sort of challenged the paradigm of needing the higher pressures. They did a comparative study, lower pressure versus higher pressure, and they found both of them stimulated stem cells.
Both increased stem cells.
Yeah. Well, this has been great. What else? Any other items that you want to touch on before we close?
Just want to make sure everybody's taking vitamin D.
Vitamin D?
I know that sounds ridiculous. Yeah, but I have had a couple of people come through with vitamin D levels of 15 or 16. and not do well. I don't think you can do all the work you need to do if your body's shut down by vitamin D deficiency. So finding out what your level is, it's a very simple thing, but it's the first thing that can't be missed.
Well, what about autonomic dysfunction, POTS, things like that? Because this, you'll see this with mold, you'll see it with some of the Lyme organisms, and these people can have a really hard go, especially if you're impacting sleep centers in the brain, let's say, and when they try to go to bed, their heart rate is elevated, or if they're having anxiousness. What experience, if any, do you have with ANS dysfunction and
So I just
hyperbaric?
treated a patient with POTS, and I was very concerned that he was going to get sick in the chamber. So my concern was that he be followed really closely. So the staff spent the time looking through the window to make sure he was okay. And he did well through the first 2 sessions. And after that, continued to get better. But we were doing other things as well. We were getting him away from his mold exposure and treating him with phosphatidylcholine and glutathione. But so that's my one case that I put into the chamber. And that my concern was, so if you were home and you had POTS and you were going to get a chamber, I would want someone else in the house with you. I wouldn't want you to be unsupervised.
Sure. In case there's like a blood pressure drop and they lose consciousness. Yeah. Yeah. That's fair. Okay. Well, Eleanor, it's been a wonderful conversation. I feel like we could talk for another few hours. Where would you want to point people online? Is there a website, social media, anywhere where you're posting, or if they want to reach you, where can they find you?
ATX Hyperbarics.com is where we are. We're in the phone book in Austin at ATX Hyperbarics. My practice is Westlake Medical Arts here in Austin. It's a very small practice and kind of exclusive, but I have a wonderful new nurse practitioner coming on who will be seeing people starting in January.
Awesome. Well, Eleanor, I guess I'll see you at the clinic. I'm curious to try this web laser here, and thank you for the work that you're doing, for the open mind and the true commitment to science. Because sometimes, and I'm sure you see this too, science is contorted to really reinforce what I already think and not learn. And it's different when you actually use science to learn rather than footnote your preconceived notion. And clearly you're in the camp of people who's using science to learn, curious, humble. So just really appreciate you and the conversation today.
Thank you very much.